Nina. I was about to volunteer anyways, so. We had a really great discussion talking about the impact that land use planning has on our health. I think it was a really great way to segue us from this morning's amazing plenary. We were talking about, some of the unusual allies to connect with in this topic. I think, a logical first connection is connecting public health with land use planning. We know that the built environment has such a significant impact on our health, and also an opportunity to embed resilience into it, recognizing it can't change overnight. But some of those unusual allies could be, tapping into technology and IT support. So ways that we could use mapping platforms and tools to convey the visual impact. An example may be looking at walkability in the built environment and how it relates to safe infrastructure, park access, air pollution, and overlaying some of these layers to convey that messaging to the public and to the decision makers and to all parties involved. So tapping into research are very key there as well. But another unlikely ally is, I think sometimes it's really easy to paint a brush of, industry or development being kind of, the naysayers or the challenge or obstacle, but embedding in or speaking to the development community directly, as in some instances, they're very receptive to some of these principles. So how can we harness that receptivity? Engaging with, citizens overall, the power in the people and the voices of the public to really, giving them the power and the tools and making these connections through educational means, really powerful. We talked about those linkages between the economic co-benefits of health as well. Health is an easy sell, an easy argument in many respects, but for those few naysayers that still remain, talking about the dollars and cents of it all, how it's going to impact their pockets, huge. We talked about communication, education campaigns, educating the public on the connections and linkages between the built environment, housing, health, land use planning. And then there was some tools that were referenced. I think for many of you, one that you may know well, the Healthy Built Environment Linkages Toolkit out of BC Centre for Disease Control, a really great resource, bringing that health evidence to land use planning. We also had some discussions around health impact assessment. So tools, Metro Vancouver has a great tool there and guidebook, as well as the National Collaborating Centre for Healthy Public Policy has some phenomenal examples. And then we talked about, there was some references spoken to about systems change overall. So, hope I summed that up well, group. And thank you.
Awesome. Yeah, that sounds like a great summary. You guys really covered a lot in your session. Great. Well, let's move on to another what is sustainable, just, and healthy, but this time a local food system.
Okay, so maybe I'll start off. I think we had such a complex topic, as a lot of the topics here are during the Summer Institute, and we just had a conversation about what is a sustainable, just, and healthy and local food system. So we really discussed in detail about some of the paradigms that exist, the push and pull. So thinking about the global versus local food economy, is it possible to be completely local? What does that mean? And does it actually do harm? Just because of the interconnectedness that we are in society, how we rely upon some of the other countries to bring in food. If we are to go completely local, what does that mean for some of those other people who rely on us as a source of their income? We talked about efficient and inefficient system in our society, in our capitalistic society. We're always striving for efficiency. How can we produce the most amount of food for the least amount of resources, or the least amount of monetary resources? But what does that mean for us as being connected to our own food? And the people that create that food. So we talked about the centralized versus a decentralized model in that. that we want to support local farmers where possible, and that there are many barriers for especially the small scale farmers in being able to produce food, because they have additional challenges, because they're not only in it to make food and to make a living, but they're also wanting to be connected to their community. But in our society, like, what are the values and how are we appreciating and not only compensating, but making sure that those farmers and those people who produce the food that want to connect deeply with their community are able to be compensated and be acknowledged for their work. When we talk about a just food system, some of the questions that we raised were, who are the people, who are the owners and the influencers within the food system that we're talking about? Who are the decision makers? All of us here are participants in on that food system, but who are the people at the end of the day that really have a say as to what that food system looks like? And this again ties really deeply into that local versus global, that centralized versus decentralized model, in that we're kind of, as a local food system, I want to call it a movement, that we're always kind of fighting uphill, but that it's an important battle to fight. And thinking about some of the important allies and people that need to be represented and that their voices need to be heard. We think about the BIPOC communities, the LGBTQ+, the homeless population. We think about seniors, people with disabilities. Like, where are those voices at the table? Just because, in public health, we think about representation and about importance of ensuring that those people are at the table. What does that mean in terms of, are they the ones that are really making the decisions? Are we creating a checklist saying that these are the people that are at the table, so yes, we are representative, versus saying, yes, these people are also equally at that table and also an influencer? Because something that I think often happens is, we have a group of people that we think that are diverse, but then when it comes to real decision making, those people and those voices are not often heard, and that those decisions are not often on the table. So really thinking about equity as well too, and really tying deeply into the conversations that we've been having around inclusiveness and about inclusivity, just making sure that all of us feel part of that food system. And I think about the indigenous communities and the people, and about indigenous food sovereignty as well too. And I think about land access and land rights. Thinking about, before there was contact, how indigenous communities, their concept of food, and I guess myself as a Korean immigrant, my concept of food, when we eat at the table as a family, it was our food. It was not your food versus my food, but about the food as a family. But how do we make sure that we instill those values back into ourselves, to making sure that we think of food beyond commodity, that we think of food as something that's deeply connected to all of us, to our society and to our community, and as a part of the social fabric. Aaron, did you want to add anything else?
One of the roles that we were talking about that public health can play is around advocacy convening. There's a lot of different ideologies and different paradigms within the food system, and so public health can play the role of bringing people together, having these conversations, and then being able to advocate on the food system. And I think one of the things, Trevor, I'm just seeing your comment here, more than 90% of the food is consumed on off island, and 50% is from BC. I think one of the things that we did touch about is a lot of the time we think about local, but we're actually part of a global food system. And if we can all of a sudden pivot to a local food system, there are so many hands in the global south that are growing our food that will be harmed and lose jobs if we do that pivot. And so really kind of think about that we're all in this together, and how do we have a just food system? Local is important, of course, but it's really around that just food system and thinking about us as a global society.
Well, that's great, guys. You guys had some great conversations in there, and once again, packed a whole bunch of stuff into a few minutes, so excellent. Let's go over and switch gears a little bit into Nexus Interconnections of Equity, Public Health, and Green Infrastructure. See what you guys talked about.
There we go. Couldn't find my unmute button. All right, yeah, this was a great group, and we talked about some pretty big things that, and the group asked a lot of big questions that I wish we had a lot longer to dive into, but it was a great discussion. We talked about essentially what the intersections of equity and green infrastructure, or green spaces and natural areas, is, with a Saskatoon lens. we talked a little bit about the green infrastructure strategy for the city of Saskatoon, and some of the analysis that we completed for the strategy, which revealed some of the inequities of green infrastructure distribution across the city, whether it was the distribution of park space, or the trail network, or natural areas being accessible to one sector of the population but not another, and then how that those inequities affect public health, people's well-being, and as well as we talked a little bit about that interspecies equity piece that was brought up earlier in the discussion. Let me just see here. We also talked about some of the policy implications for that work and what we need to be doing sort of at a provincial and municipal policy level to allocate green spaces more effectively right from the planning stages of city design, so that we're not just considering green spaces in natural areas after the fact, but we're building that right into the design of cities before road hits the rubber, so to speak. And then we also talked about the intersection of things like classism and racism in green space access, and that ended up touching on a lot of these other discussions that we're having as a society right now with anti-racism work and policing, and how does that relate to everyone being able to access green spaces and feel safe and welcome, because feelings of safety are also not evenly spread across society, and going deeper than just band-aid solutions into that. And then we also talked about how this discussion about green spaces in cities relates to One Planet Living, and whether we can improve our green infrastructure while also making cities more self-sufficient, whether it's through food security. We talked a little bit about Indigenous food sovereignty and traditional food practices in green networks in cities, water security, things like that. So that kind of talks about or touches on some of the things that we talked about in a very high level way. And yeah, it was a great conversation. And yeah, thanks for everyone for participating.
Awesome, thanks very much. And just a reminder to everybody, I know that all these conversations are getting going and you're probably just getting steam and then have to come back into this main room to kind of discuss it. So, you know, don't forget, after the Summer Institute is over, we'll be sending out a post-Summer Institute package with a bunch of resources we've talked about, and access to videos and everything, so you guys can continue learning and sharing with everybody. And we'll also have a networking contact list. You guys were asked if you were going to consent to put your email on that list, so I'll send that out as well, so you guys can continue the conversations later. And then of course later on today we'll have you broken out into your regions, where you can discuss everything that you've learned over the last couple days and how you can really make a change in your local communities, taking everything that you've learned. So with that said, let's move on to what is a sustainable, just, and healthy local energy system.
Thanks, Christina. Thanks, Diana. Dan. Yes, so we've got this here. We had a great conversation, and we looked at a lot of aspects that could be involved with energy efficiency and transition to a 100% renewable, or what does net zero look like for us. And a big item was equity, and equity in terms of the just transition for folks affected by that, particularly oil industry and people with jobs there. I think it was really good to talk about that. We highlighted some of the items that are almost being kept from people because there's options for the oil and gas industry to transition in terms of blue hydrogen and also some other aspects like getting into certain aspects of renewables that are some of the lowest cost energy systems we know now. And also from the terms of equity for low-income folks and energy poverty. Like the equity in that respect is we're having some of the poorest buildings are being lived in by folks who have the least means to do so, to pay for those energy costs. And so energy poverty is a major concern. We talked a lot about energy efficiency in buildings, education on this. And I should note energy efficiency from the perspective of building the building in the first place more energy efficient, and less about occupancy or less about occupant behavior changes. We can build efficient buildings that are healthy and that encourage healthy living just in their construction. And that we should embrace collaborative processes for building these homes. We can use co-housing. We can use energy co-ops to build the infrastructure of the future that we want. Something that we mentioned was, could we take existing strata or condo developments and turn them into co-housing? And I think that would be a great idea. So for more supportive living and more action on climate change within our local communities. So yes, that's it in a nutshell. I think if Diana had anything to add, she could.
No, it sounds like more great conversations. Thanks very much for taking time of your day to join us for that. It's really great to hear. I know a lot of people were talking about transitioning into energy systems in the earlier plenary session today, and then there was some chat about it yesterday, so it was great to get deeper into that topic too. Let's move on now to zero food and packaging waste in our communities.
Rory, if you're there, do you want to take this on with Chris?
Sure. What maybe I'll do is start, and then I know Chris did a great job of monitoring the chat, and so he can maybe provide some additional nuances there. So we began with just really looking at how much of the waste we generate is food or food packaging. It's potentially 1/3 to a half of what we collect either in the municipality or regionally. And really looking at those two things together, the impacts of landfilled food is one of the biggest GHG contributors we have globally. And obviously our packaging, our plastic packaging, is having increased awareness of the environmental impacts of that globally as well. Plastic is being, microplastics and new macroplastics are being discovered everywhere in our environments, including those environments we thought were pristine and free from these materials. Just seeing how prolific and easy it is to easily dispose of these items, and I think that's a bit of a troubling issue is the just the ease in which they can go to landfill. And I think when we look at these areas, there are opportunities, and they're probably low-hanging fruit. I think we just talk about that there's a lot of good examples out there of people taking action, especially at a local level. And if we can scale those and aggregate them up into either broader systems or processes, then we can definitely have a big reduction when it comes to these two items. I think when we look both of these items together, the connection and what's the sort of the best outcome is reusing. So how do you reuse food? Well, food that could be eaten, you give it to people who are food insecure, who need food to eat. I think that's the consideration for reuse there when it comes to food. And for packaging is finding those safe, systems for using reusables and displacing all the disposable products we use with reusable products. It's possible there's growing examples of how to use reusables safely, and there's in some cases as well, there's growing evidence to show that the safety of those reusables are more safe than disposables, because you know who's touching it. You can guarantee that locally it's being sanitized and redistributed. So that was an area of discussion. I think there's a lot of questions and interest in just how prolific the problem of waste is, and at the same time, just how many options there seem to be addressing it. It seems it's not only problematic, but in many cases needless. And so just finding those low-hanging fruit and introducing them seems like a great opportunity. There's a bit of discussion around public health and health waste. It's a massive contribution as well, and just a lot of that as well is maybe perceived to be necessary from those practitioners in the waste side, but definitely not necessary and when we sort of unpack it in more detail. Those were sort of the big insights I got from it, and I'd be sort of curious, Chris, some of the more nuances that you saw during the chat.
I think you covered it very well. But during the chat, I think there was a lot of focus on and surprise at how much waste is actually going to the landfills that is actually organic. I think that came back to us in a lot of ways. And the difference you raised in between, when the municipality kind of where food waste kind of begins, because you also emphasize the difference between food loss and food waste, and that there is certainly a difference there that I certainly learned from. Trevor, do you have any further comments?
No, that's good. Thank you both.
That's great, guys. Another great conversation. I'm especially interested to watch it later when you're talking about being able to make reusables safe and sanitized, and you know where you're coming from, because I know especially with this current pandemic, a lot of stores stopped letting you bring in reusable bags or use your own cups at drive-throughs and stuff like that, and they now have started restating that again, which is awesome because I've amassed a few plastic bags from the grocery store since the pandemic started, and I'd finally got through the last of mine by using the reusable bags, and there I am back again, having this waste that I don't want. So definitely interested to learn more about that and how we can kind of shift people's perspectives on reusables.
Sorry, there was one other quick point I'll add that I don't think is on the list there from Chris. That the health sector itself is a major source of waste. And if your health authority doesn't have a waste reduction and recycling program, it should. It probably does, but it could be better. Check the Canadian Coalition for Green Healthcare for lots of good ideas.
Great point to make, especially with this crowd. So that's awesome. We'll go into our last session now, which is beyond light rail and bike lanes. How do we move ahead with sustainable, just, and healthy transportation systems? And I know we're technically in lunch, but we did start a couple minutes late with that extra logistic time. So thank you, everybody, and here you go. Off to Rita's group.
Sorry, could I just get you to stop sharing your screen?
Chris, you need, yeah.
Thank you. Let's see. Sorry. Okay, so we also had a really rich discussion in our group, and I wish we had so much more time because this is an area that's near and dear to my heart, as well as obviously many others. But a key theme that came out for us that seems to have come out for all of the groups is really a health in all policies approach. And the idea that, you know, public health and the health system deals with the downstream effects of an unsustainable, unjust, and unhealthy transportation system, but the people who make the decisions on those systems are non-health professionals typically. So planners, designers, engineers, and so really when we were talking about the role of public health, we discussed really engagement with those decision makers and knowledge sharing and mobilization, but also thinking, we reviewed a few examples of how engagement with many community groups and members is really key, and to have those people at the table in a
We're
meaningful
discussing
way.
sustainable, just, and healthy transportation systems, aka bike lanes.
Sorry, Chris, you weren't muted, and we could hear your conversation, which may be with a family member. So go ahead, Samantha. Sorry about that.
I wasn't sure if someone was trying to interject there. So we talked about more than bike lanes, which was, so some good examples, such as, you know, how do we get the lens of not just able-bodied, middle-class suburbanites at the table, but really applying that equity lens. And so this needs to be incorporated into zoning. So what's considered residential, commercial, mixed zone areas to really make things more accessible, make active and public transportation easier and more desirable. Promoting not only the cost-saving opportunities for the system through active living and reduced injuries, but also sort of the cost implications in the short term, and how we can balance the, you know, the needs of cars. We've had a lot of great discussion around the challenges, particularly in northern communities with long winters, and very car-centric cultures with suburban sprawl, and a similar theme to the housing conversation, the energy conversation, the food system conversation. Really, it's a long game, so we need to start making incremental changes now, but the key is to be at the table for those planning discussions, because once the things are built, it's a lot harder to go back. Does anyone from the group, Rita or anyone else, have anything else to add?
I'll just add that of course, active sustainable transportation includes bike lanes, but you know, we're just being a little bit provocative in that title, and you know, we really, you know, what we really wanted to talk about was just some of the complex decisions around who is able to, why is our transportation system all centered on the car when the car does not necessarily serve people with disabilities, people living in poverty, which includes racialized communities, children under 16, those that cannot drive or choose not to drive due to you know, disabilities or age or multiple factors. And so really thinking about developing a transportation system that really puts people at the center and that is networked and connected so that people have those social connections, as well as connections with all the other things that people mentioned in terms of food and housing, but putting people at the center of it, and not making assumptions about the needs of people. So planners tend to be professional middle class, you know, men, and we really have to think about this by having women with children, racialized communities, low income people with disabilities, people with different disabilities who may have different needs, and so really, you know, I think it's just really important to have that conversation, and to be for public health to be at the table in terms of the health evidence, but also to be lifting and supporting the voices in the community that we know a good transportation system needs to serve. I'll leave it at that.
Great, thanks very much.